Most people, they've heard of ear infections and bedwetting. One of the things about bedwetting is that parents try their hardest figuring out, okay, how do we wake them up? Do we make them not drink? Do we make them get up and go to the bathroom? Do we wake them up halfway through the night and have them go to the bathroom? What do we do? Do we put the alarm pad on? Do we, there are so many things out there, and the frustration level and the embarrassment level for the child just goes beyond, especially once it passes a certain age and they can't spend the night because they have to wear a pull-up at an age that, their friends aren't wearing them. One of the things that we do is we check the alignment of the bone structure at the base of the spine. That's where the nerves come out that actually control the bladder. If for some reason, if your forearm has a weird feel and you feel like you have to pop it, that's a change in the way the nerves are communicating. If a child who falls down quite often, one of the bones move and it changes the way the nerves to the bladder are communicating, do you think they're going to wake up at night when they have to go? Do you think that trigger is going to be as strong as it needs to be to wake them? As hard as kids sleep, that's part of the problem, is that nervous communication just doesn't, that relay doesn't get to the brain as quickly as possible. And when they get adjusted, I had one child, they had him sleeping on a pallet on the floor. He's 5 years old. And it was to the point where they were just like, he's going to ruin the entire bed. And they brought him in at wit's end, not knowing what else to do, and having had a recommendation from someone outside their family and said, try this. And sure enough, immediately, no more bedwetting. And that lasted for about 3.5 months. And then he started gradually starting to wet the bed again. They went to the chiropractor again. No more bedwetting. And this went through a cycle, but it overall, the response was phenomenal for that child and his sense of well-being.